Well, my auntie is a CNA, my grandma's like a RN. Most of my family of women is all nurses in the nurses field.
Wow, Spider-Man on a Friday. Okay, from ER crisis to delivering babies, caring for the elderly in their last moments, to serving on the front lines of the COVID pandemic. Nurses perform some of the most critical and loving tasks in the medical world. We kick off National Nurses Week today. So today we honor them and say thank you. The Morning Medical Update starts right now. And good morning to all of you on this Friday, May 6th. I'm Jessica Lovell. Thank you so much for joining us here on Facebook, on YouTube, and on Twitter. Coming up later, celebrating a big anniversary, a local shop helping cancer patients feel beautiful and feel confident. They turned 10 today, so we're going to take you inside Missy's boutique. In about 15 minutes, Dr. Dana Hawkinson will join us with the latest COVID-19 numbers and some COVID headlines. But first, celebrating the hard work they put in every single day here and across the country. It is National Nurses Week, so why do so many of them choose to do what they do? Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. We begin with this morning with some big developments involving the COVID-19 vaccine. The FDA is now restricting who can get the Johnson & Johnson vaccine because of a potentially deadly side effect. We want to bring in Dr. Steve Stites and Dr. Dana Hawkinson to talk more about this and kind of dive into what this exactly is. So I'll let you get us started.
Yeah, you know, I think what's been happening, there's this thing called post-marketing surveillance that happens with any new therapy, especially these therapies that were under early EUA. You had to continue to submit data. What we've seen is that, and we saw it early on with the J&J vaccine, there are increasing concerns about the clots that have developed and some lives that were lost as a result of that. Now, the numbers are like 1 in a million or 1 in 2 million, so it's not very many. But Hawk, we have so many successful vaccines right now, it doesn't make as much sense to try and to have one that has a little more risk, even if it is successful.
Yeah, you know, I think you're right. You know, these events continue to be extremely rare. Obviously, they are tragic if it happens to you or a loved one. But it is true, they are rare, but just exactly what you said. And I think some of this also has to deal with the constant evaluation and data analysis by the FDA looking at the safety and efficacy of these vaccines. And I think that's a win for everybody. They are still available, but as things have changed, as we have individual immunity now with vaccination and infection or reinfection, but also population immunity, they have pivoted towards this stance.
I think if we didn't have the mRNA vaccines and this is the only one we had available, it wouldn't be being de-emphasized.
Correct.
But the choice is we have great vaccines available and we have new vaccines coming down the pipe that also look really strong. We just had two other ones talked about this week in the New England Journal of Medicine where they documented good efficacy of these other two types of vaccines, which are both a little bit of a novel approach. We'll see how those get into the market. But I think the mRNA vaccines are really successful. They have very, very, very few side effects. And what's also clear, they can pivot rapidly. Moderna is pushing some preliminary results of some of their vaccines that look at a combination with both special design for Omicron as well as the standard types of the other types of COVID-19, and looking like it may be a little more effective, Hawk. So once again, the mRNA are safe, effective, they have the ability to pivot, and that pushes the J&J vaccine to a backseat.
Yeah, absolutely. But I think we should still emphasize the J&J vaccine continues to have very good efficacy against hospitalization, severe disease, and death. And just as you said, if we have other new options that may come down the pike as well, obviously the bar is going to be set extremely high because of the mRNA vaccines of efficacy and safety. But if there are a couple vaccines that also come out that allow more people to be less hesitant and anxious about getting the vaccines, to help their immunity, help reduce their chance of going to the hospital, I think that's a great thing.
And just one last thing, I think it's important to note that these are complications that occur early after vaccination. So if you've had the J&J vaccine, I don't think you have to worry about a late onset of a new complication.
Glad you mentioned that. Let's pull up your heat map too. We
All
take a
right,
look at that.
yeah,
I know you love it.
Yeah, I don't love it right now.
All right.
So the heat map is growing. Lots of concern out there about the rapid rise. The CDC is beginning to pay more attention. You can see how much darker this map was than 2 or 3 weeks ago. The number of cases being reported, and remember, there's less testing being done, and yet the numbers are starting to rise. It's up 47 to 50% over the last 2 weeks, Jess. In addition, we're seeing hospitalizations rise. Hospitalizations are up about 18% to 20% in the United States. The good news is that even though hospitalizations are up, the amount of oxygen being used is not up in those hospitalizations. In fact, it's down compared to the original Omicron and the COVID, other COVID waves like the Delta wave. But the other thing we have to watch out for is ICU has death rate climbed. Death rate has not climbed yet, but Hawkeye, it's early. We'll have to wait and see. But this is a trend we should expect. We're going to go through these periods of relative quiescence, and then we're going to have another wave. And that's what we've said before. We have to be nimble. We have to be quick. We have to be ready to pivot on a stick.
Yeah.
Not bad. Right there.
Or a needle stick.
Or a needle stick. Let's not do needle sticks.
All right, we're going to get to more COVID topics here in just a bit, and we'll get to those numbers as well. But for the last 2 years, when you think of nurses, these are the images that come to mind. Many helping COVID-19 patients recover, in cases, many of them being with them in their last moments. This morning, we show you why we take this time to say thank you to all they do.
We go into this profession to see people get better.
EMS arrival, room 15, here now.
Nick, 15, might be having a seizure if you'll go check on that. A lot of moving and grooving and being really creative.
This past wave has definitely felt a little bit different. The patients seem to be a little bit sicker than what we've seen before. You know, all the treatments we're doing, sometimes it just doesn't feel like it's enough.
Sometimes it happens so quickly there's not even time, and we call family after it's done.
Patients are still coming in. They're not slowing down, but we just have all the COVID patients on top of that. It's affecting the entire hospital, and so I think we're all feeling the pressure.
So hopefully we can all take a step back and realize it's not just about me or you, it's about everybody.
Nicole, do you need anything? Staff has been feeling it for sure. I've been a nurse down here for 5 years, and we are probably the busiest that I've ever seen us.
All of our typical patients, like patients with cancer, patients who are recovering from organ transplants, and then also COVID patients, trauma patients as well.
Emergency department, this is Stacy.
So it's been very busy, but luckily we have a great team here. We've been able to rely on each other. That's like the most important thing, I think.
What keeps me coming back? In triage, Casey is at T1. The team, Allie and Nick are in the front hall. I really enjoy the team that we have down here. Thank you all. Knowing that I get to show up and be here for these nurses, and that they do the same. We have a really good team down here in the emergency department, and I feel very grateful to be a part of it.
There are more than 100,000 registered nurses in Kansas and Missouri, and we cannot say thank you enough to all you do. National Nurses Week starts today, May 6th. It ends on May 12th, on Florence Nightingale's birthday. So why do so many choose to follow in those important footsteps? We're going to talk about that today, because joining us now is Tammy Peterman. She's the president of the Kansas City division here at the health system. We also have Rachel Pepper. She's chief nursing officer. We also have chief medical officer, Dr. Steve Stites, where you're going to talk about why you cannot do what you do without your favorite nurses, right? So we're going to talk a lot about that and sing their praises as we do every day. Tammy and Rachel, you both long-term nurses here at the health system. You're now in leadership roles, but just quickly, Rachel, tell me what inspired you to become a nurse.
Sure, my grandma was a nurse, so I knew from a very early age it was such a special role to be in, and I just always knew that I would take that path.
And Tammy, you also grew up, you had a father who was a physician in a small town, and so you kept it in the family as well, right?
That's right. I think a lot of people have a story about why they become a nurse, and certainly I grew up around the healthcare world when I was very young. My dad would take me on some of his house calls, or I would go to the hospital with him, and I got to see the whole world of healthcare, and I'd also spend a little time with some of the nursing staff at the hospital on the evening shift or the weekend shift and those kind of things. And I just think early on, people will decide, they want to be a teacher, they want to be a nurse, and oftentimes they follow that dream and that passion. And certainly I know a number of people that I know did just that.
Yeah, that makes sense. I think if you're able to have that perspective of seeing them up close and personal, that makes sense to follow that same path. So what has changed? I want to ask all three of you, what has changed, or maybe perhaps just simply stayed the same when it comes to nurses during this last couple years, during this pandemic? Rachel, what have you heard? What have you noticed? Heard from colleagues and nurses up there on the units?
Sure. The last couple of years have been so interesting because there are a lot of things that have changed. We had a novel disease and people were masking and there were more limited visitors and so many things around us that presented challenges. And yet with the nurses, I think despite all of those things, so many things have stayed the same. They are focused every single day on their patients. They want their patients to get the very best care. They work as a team and they truly just bring their A game every single day. And those are the things that are inspiring to see that they've chosen not to change despite everything around us being really challenging at times.
Well, I think, Tammy, we've talked about this before. I think nurses just kind of have what it takes. In some ways, you've said you really weren't surprised that they were able to face this head on. What do you mean by that?
Well, I think that nurses do what nurses do, whether it's a pandemic or it's not a pandemic. And I think there were many things that changed and we needed to change. And, we don't like the word pivot very much anymore, but we did have to pivot from time to time when we had more information, when we knew that there was information that would lend us to do something different, we would do those things. But nurses have always been able to adapt to different situations. But I think at the core of nursing, it never changed. Mm-hmm. They provided unbelievable care and support to patients and their families. And they did this sometimes in really difficult situations when we didn't have visitors and we didn't have family members, and they became the conduit to the family members. And the way they did that in such a creative way, I think is pretty remarkable. I think we should all be in awe of what happened during the pandemic and always when we look at nursing.
Dr. Stites, you're on deck because you're a physician. I want you to speak from a physician's standpoint about what nurses mean to you.
Yeah, you bet. So if you were here Wednesday, you would know a lot of it because on Open Mics, Joyce Funk was here with me. Joyce and I have worked together for 18 years in the care of CF patients. And at the end of the day, the best care is delivered by the best team. And the best team has to have a great dynamic. And someone is often carrying the ball. And if I think about that, I look at nursing as the team the part of the team that's often having to carry the ball. Mm-hmm. Because when things are tough and the game is tough, then I think if you watch our nursing staff at the bedside, whether it's in the hospital or even in the ambulatory practice, who's the person that's really in constant contact with the patient and their family? To me, that's carrying the ball. And I think the nursing staff does that, and I think they do an amazing job here in many places. I've been privileged to work with Joyce for 18 years. I'm not sure she thinks it's been a privilege.
She thinks it's been a lifetime.
It's a sentence.
She thinks it's twice as long as that.
Yeah, she blamed all of her gray hair on me. But at the end of the day, the best care is delivered by the best team. The best team is the team that can communicate well and recognize how they each have an incredibly important role in taking care of patients. I think our nurses do an amazing job. Here's another example. So yesterday I had a patient out in photopheresis, and photopheresis is this procedure where people like chronic rejection for their lung transplants or their bone marrow transplants have to go and try and have that treated. And she called me and said, hey, listen, you need to come see this patient because they're not doing as well. So I went over there and they're like, holy cow, what happened here? And it's that kind of person. Eyes always focused on what's right there and trying to take care of that patient. That's a big deal. I get to move around and flit and go from one thing to another, but the nursing staff is already right there at the bedside. They're the folks who are most in tune with the patients. They're the ones who are the best communicators with the family. They're the ones who are really the folks who are going to tell you when things are going well and when they're not. And if you don't listen, your patients aren't going to get very good care. And so I think it's really about the teamwork. It's about the dynamic that you have. And when you have that open line of communication and people feel free to talk with each other, people get the best care.
They're your true link to your patient.
Absolutely.
Rachel, how has the role and the perception of nurses changed over time? And Tammy, I want to hear your thoughts too, just from when you entered into nursing, just to the way we see them now. Certainly a pandemic helps because they were certainly thrust into the spotlight, but up until this moment, how has that role changed and evolved?
I think the role of the nurse has grown a lot over the last many years. I think it's sometimes in parallel to healthcare, and you think about how patients get care. We still have patients in the hospital that are very sick and need inpatient care. And there are also a lot of patients now that we're able to manage in a home setting and chronic disease management, and we can do procedures and people go home in the same day versus longer hospital stays. And so as those types of things have changed, so has the role and the opportunity for nurses. All patients need a nurse. And so there's a lot of ways that nurses can serve in different positions and different skill sets that they can expand into. I think the things, though, that have stayed the same as Dr. Stites shared, nurses are key members of the team, and we work as a team, so they have the chance every day to be good communicators and advocates for their patients and leaders on the team to make sure that we're focusing on all the right things day to day.
Tammy, something I'd love that you talk about and point out is certainly here at our place is that nurses and doctors work right at the same level all day, every day. I'm sure you would agree with that. I mean, they are looked at as the same. Kind of help us understand that and how we got to that point.
Well, I think that's probably evolved over time as well. But at our place, we really believe in the value of the partnership. And physicians and nurses have always worked together. I think it's the partnership that probably has evolved and strengthened so much, certainly at our place. I think about the things that have changed, and a lot of things have changed. Of course, there are so many advances in healthcare and in medicine, and that's great. But one of the things that I know hasn't changed, and Rachel mentioned this too, is just the care of the patient. When I think about the things that have changed, there are so many advances. The technology has changed and evolved. Medications have changed. Treatments have changed. A number of things have changed, and that's all great. But the care of the patient that the nurse provides, that's pretty much the same. And I think whether it's in a high-tech environment or not, the care is the same. And I think that's something that I love is consistent. It's care and compassion. One of the things we say around here is you merge science with compassion to deliver exceptional care. And that's what happens with nurses at our place. And we do it as a partnership with the medical staff. I remember getting a note from one of the critical care physicians about, I think I'd sent him a note. I thanked him for something he had done. He was talking in this note about some other things. And at the end he said, this is in the middle of the pandemic, he said, I hope we never have to go through another pandemic, but if we do, I want it to be with the same team. And I thought that was the most powerful thing, because what he's saying is our team did it. Our team does it every day. And those aren't just words. When we say our team does the work, we mean it, because that's how they do it, and they do it in partnership.
Anything to add, Dr. Stites, to that?
Here's a good story just right on top of this. After we got down on Wednesday, one of the mothers of one of the patients who was on the screen with us wrote a note to Joyce and I and said, you guys are the greatest team ever. And I don't know if we really are, but the point is she recognized this as a team. And I think that's what's changed in medicine a lot. And I think for the betterment of patients. I think if you have one person, one part of the party that's very dominant and kind of shuts down communication, and I think that's not the sort of recognition. If you look at what happens on a football team, and if one person starts to act out, and the whole team begins to suffer, right? And I think this is about trying to work well as a team, and I think our nursing staff here does an amazing job.
I don't think docs would feel good taking all the glory. I think that anytime somebody
I think if you do, it's a mistake.
Big
Because you're gonna take a fall,
You are gonna take
and
a
the person who takes the fall is the patient. And that's when you get in trouble. So it's really important that we recognize. I think to your point, I think the bedside care, I think it's even better. But nurses have always worked really hard. But the recognition of that and the stressing is that teamwork
that
has
hasn't
changed.
Yeah.
Well, but I think that the dynamic has changed.
Yeah.
I think it's a much better dynamic than it was 15 or 20 years ago.
But like you said, the hard work hasn't changed.
No,
but the way we acknowledge them and hold them up I think that's great. Absolutely.
Well, I also think there are just so many more opportunities. Rachel mentioned this as well. Nurses are in every area of healthcare. We have such an appreciation for nursing staff, whether they're in the procedural area or behavioral health or ambulatory areas, the cancer center. Nurses are everywhere care is provided.
So speaking of opportunity, I want to segue into a community question that we have from Beth, wanting to know, where do we stand locally and nationally with nursing shortages? Rachel and Tammy, I'll let you take that.
Well, sure. And everyone has read the stories and they've read the articles and they know that across the country, and it's not just in nursing, but in healthcare positions throughout the entire healthcare industry, is that people are deciding to do something different because the pandemic has really caused people to evaluate, gosh, is this what I want to do, or do I need more flexibility, or whatever. Those kind of things are happening, and we know that. Our turnover has actually gone up. I think that our turnover is close to 14%, I think, in nursing. But nationally, the turnover is much higher. I think we just saw the turnover for 2021, nursing turnover across the country was about 27%. That's the average. That means there are a lot of people that the turnover is even much higher than that. So I think we're seeing some of that. I'll tell you that the last few months, our turnover's been pretty low. So there was a little turnover. Initially, people needed to make some changes or adapt to their personal life and maybe stay home a little bit more and work part-time and those kind of things. But I think the turnover's really been low the last few months.
Yeah, that's absolutely true. And as Tammy alluded to, we take so seriously taking care of our team that we have, because we do have some open positions. We've also had some growth in our health system. So, of course, opportunities for people to come join us. We also want to make sure we retain all the great team that we have, because we need them, and they're giving great care to patients every day.
How was retention, though, during the pandemic? I mean, people were they were worked to the brink. I mean, if there was any time to just say, I can't take anymore, that would be it. And that's when we needed them most. So how did they find that balance?
Well, I think our team, our leaders, the frontline managers, I think they worked really hard to meet the needs of their staff. And if people needed additional flexibility, we tried to provide that. I think as an organization, we worked really hard to make sure that people knew how important they were, because they were and they are every day. And I think that's what helped us as we went through the pandemic. We're still, of course, and a bit of that as well. But I think the retention was great. I'm really pretty impressed with the way people have they stayed here. They didn't say, man, I'm headed out. They were great.
Just when they thought they'd had enough, they came back one more day, and a lot of that was because of the patients. So
I think in medicine we've gone through eras of medicine and healthcare, and I think in the late 80s and 90s there was an HIV era when people struggled a lot at the bedside, because you and I were there, right? There were a lot of deaths, and we talked before about how HIV admissions, 80% of people would die before we had the rise of AZT and other therapies with each admission. So that was difficult. I think this is and it's a harder one because it's more far-reaching, and you can't get away from it. In HIV, you could go home, and you were probably going to be okay. But here you go home, and you're still in it, and you're in all the swirl and all the controversy. So I think for our nurses, especially our bedside nurses in the ICU and the ER and up on the floors, taking care of these patients and watching them struggle, and then going home and watching society struggle, I think they've borne the heaviest load of any group throughout the entire pandemic.
Yeah, Steve, you and I have talked about this. I think that everyone in the country, everyone in the world, actually, they've experienced this pandemic, and some very personally, but everyone has experienced the stress of this pandemic. But not everyone was at the bedside of a patient who was dying, and not everyone was in the ED or in any of our areas or our ambulatory areas, and needing to make really quick adjustments to make sure we were providing the very best care in the safest way possible. They experienced something that no one else has experienced. And I think you add that to what everyone in the whole world has experienced, that's pretty tremendous.
It's pretty traumatic.
Yeah.
I think the nursing staff has done an amazing job of that, because at the bedside it was the nurse who was there when people died, when visitors couldn't come in. It was the nurse who then had to take care of that patient after they passed away. It was the nurse that had to try and communicate with the family. That's a big responsibility.
And we're talking about nursing today, but I think we also have to acknowledge the fact that when we're talking about the stress of providing that care, there were a lot of people on that team. The respiratory therapist and the physician, the pharmacist, and so many other support individuals who experienced that as well.
Funny you said that, because we were pulling video of some of our nurses, and there were respiratory therapists in there, and we kind of just made this decision. We were like, oh, they're getting acknowledged today too.
Yes,
nursing or not.
I totally believe that.
They are caretakers.
You're right. It takes a team. But only one group was actually right at the bedside the entire time.
All 24/7. That's right. Absolutely, 100%. Hold your great thoughts. I'm going to turn to Dr. Dana Hawkinson really quick for a check on our COVID count. Good morning to you.
Hi.
Hi.
How are you? You know, right now, active infections in the hospital, 6 active infections, 1 in the ICU, 0 on the ventilator, still 10 in that recovery period. Again, the active infections are still in that single digits. That's good. If we can keep as many people out of the hospital as possible, that is what we want. That is why we continue to endorse vaccination, being up to date with boosters. And also, if you have symptoms, test as early as possible so you can get on that outpatient oral antiviral Paxlovid, or even possibly get the monoclonal antibody bebtelovimab, which we are still giving here at the hospital. So it's vitally important if you do those things, your risk of continuing outside of the hospital, not being hospitalized, continues to be very great.
So, Hawkeye, can you possibly talk to the FDA about how they name these monoclonal antibodies? Because they've got some pretty interesting names, right? Bebtelovimab, really, who came up with that?
Yeah, you know, they just make things up. I think there are certain letters that all these drug companies want in their drugs, so they sound cool. You know, it's usually a V, an X, a Z, something like that.
Like that, yeah.
So.
You know what's not cool though is the rise in numbers. We saw in the heat map and in New York, and it's really started in central and upstate New York. It's now spilling over, as you saw in the map, to all the northeastern states. And what we know is that hospitalizations are up there. Mm-hmm. Now, nationally they're up 18%, but in some areas they're up 50 to 60, 75%. So I think, unfortunately, we are going to see, there's the heat map again. You saw that darkness in the northeast part of the country. We are going to see another wave, and it's going to come sweeping this direction. And I think in the next 6 to 8 weeks, we'll start to experience it more here. And I think just be ready to pivot. It's great to not have masks on right now in the public and go into spaces, but they're starting to put them back on in the Northeast. I suspect that's going to come here. Otherwise, we're going to see the same
And
rise.
I think the real concerning thing with that, Steve, is just as we now have heard and understand, and we've always believed this, that the deaths have been underrepresented since the beginning of the pandemic. I think right now we are going to see that more with the cases, just because less PCR testing, less reporting to the states, more at-home testing, or again, people just not testing, assuming that they have the
Which is why hospitalizations is your barometer right now. And the reason you would have to take on more public health measures if hospitals get strained again. And we're already under a little strain because of the contrast shortage we've been talking about. But, if you throw a COVID shortage on top, or COVID crisis on top of that, again, it could be a bumpy ride a little in the summer. Hopefully not. Hopefully it'll be mitigated, but be ready.
Today kicks off National Nurses Week. So joining us, of course, is Tammy Peterman, president of the Kansas City division here at the health system, and Rachel Pepper also joining us at the table to talk more about that. So I want to pull up a quote, Tammy, that one of your favorite quotes, and just kind of share how this, well, really anything Maya Angelou says is fantastic, but this one certainly pertains to nursing, and why so?
Well, I think people may forget what you said, but people will never forget how you made them feel. And I think that when I think about nursing, and I know that they do amazing things, they do it in this high-tech environment, they are providing unbelievable care, but it's also the way they make patients and families feel. And I think they answer questions, and they relieve stress, and I just think there's sometimes the connection to a lot of aspects in healthcare.
I don't think I've ever told you this story, and I can't believe I haven't because I tell you so many weird things about my life. But
I do love that, Jess, by the way.
No, I'm telling you right now.
Oh, here we go.
So here we go. Sit back. So I'm lucky enough that the only time I've really had interaction with nurses is when I had a baby, and my daughter was in the NICU, which was really a horrific event. But I remember spending 4 days, because I'd had a C-section. I was able to spend 4 days in the hospital because that's how much the insurance lets you stay, and then they have to gently kick you out. But I remember thinking to myself, I started crying to my husband, and I said, can we just pay out of pocket so that I could stay here and let these women take care of me? Because I said I didn't want anybody else to take care of me. I said I needed their emotional support. There was something so primal about another human being you don't know helping you go to the restroom and helping you take a shower, and hearing horrific cries and moans and weird things that you do when you're going through this really painful time of your life physically and emotionally. And I remember I Facebook friend all of them afterwards. Because I just needed to feel close to them. It was I'd never felt that way about anybody in my life, having somebody that I did not know feel like I felt so close to them, and I needed them more even after I took my baby home and everything was okay, it was just like I needed that relationship with them still. So it was something, nurses stood out to me.
Well, it's an amazing connection that I think a nurse will have with a patient. And whether it's going through labor and delivery and postpartum and all of those aspects, or it's going through cancer treatment, or it's even being in the ambulatory areas when you're getting lab results back, or when you're hearing about the next test you need to have done, or in any of our areas. I just think there's a connection that happens.
There really is, and watching somebody take care of your child and just helping you through that, it's a really interesting, So I love you all. I love all you nurses so much. Tammy, your daughter's a nurse also. That wasn't always the field she was going to go in, but there was a moment that happened where she said, and here you both are celebrating our 4th magnet designation this past year during a pandemic, by the way. And so Claire decided to be one, but she wasn't going to be one. Tell us about that.
Well, sure. And we had the opportunity to share this here within the health system the other day. This is actually a picture when we are in the NICU, when she had a baby who was in the NICU just a few months ago. When Claire went to Mizzou, by the way, she did go to Mizzou, and when she went to Mizzou to college, she said, I'm going to be a political science major, I want to be an attorney, that's my path in life. And we said, you bet, whatever it is that you believe is important and your passion, we'll support that. After the first semester, she came down the stairs at Christmas break and she said, I don't think I'm going to go into political science. I want to be a nurse. All along, my husband had said Claire would just be great in nursing. Claire had to figure that out herself. And I said, well, why? And she said, Mom, you've always said that whatever we do, we need to make a difference. And she said, what I see is the difference that nurses make every day. I said, okay. I'm all in. That's great.
And here she is. Proud moment, I know. Right. Rachel, kind of be an advocate, because if there's people out there who maybe have a up-and-coming kid or teenager or high schooler or someone going into college and they're trying to make a decision on the path to take for nursing, kind of help us understand what that looks like.
Sure.
So maybe they can make a good decision.
Yeah, I think there's many paths that people can take into nursing, and I think first it's so important us as nurses and of course families and others to really support people and encourage that, because we do need people to enter nursing. I think one of the most best ways for people to start is in patient care assistant roles and working in an unlicensed role, learning about what it's like to give care to patients. And then, of course, that formal nurse training, entering into, there's many different degree paths and routes that you can take to become an LPN, a licensed practical nurse, or a registered nurse. And the great thing about nursing additionally is it's a career of learning. And so you start somewhere and then of course gain career experience and further schooling that you can do many different things throughout your career.
So you could start at a community college and get some of those credits, or maybe get an associate degree and then turn that into something, and then choose your path from there as well?
Yeah, that's absolutely true. You can start on an associate degree path. Some people start straight into a bachelor's program and start their nursing career there. And from either of those paths, there's master's degrees and doctoral degrees, and just really day-to-day taking great care of patients and learning from the colleagues around you are the things that shape your career and lead nurses down a lot of different paths.
I want to get to a community question, and one is from Ruth, and it's a good one. How diverse is your nursing staff? People of color in nursing? I keep hearing someone who looks like me is important in healthcare. Dr. Seitz, I know we talked about that on open mics once, about how important it was. You had a guest on, African-American woman, who said that a patient came in and said, wow, the fact that you look like me has just totally changed my experience.
Makes a little difference. They say people get, they listen. There are these studies on how people listen, that people will listen to someone who looks like them 35% more than they do to somebody who doesn't. So diversity is huge, and at the bedside, I think it's especially huge.
What does our diversity look like, and how do we work to gaining more at our place?
Yeah, this is something we've really focused on a lot and talked about as a team over the last many years, because it's really important to us to have a diverse workforce and all aspects of that. We think about the background that people bring with them, whether it be related to gender or race or the way that they grew up or things that they think about and how their lives have been shaped. It all brings differences amongst us, which differences in the team are what makes us stronger. And it's been really important for us to build up a team that is diverse and well-rounded and that our patients can connect to.
Tammy, anything to add to that?
Well, I think we're intentional about that. I think you have to be intentional about making sure that you're supporting diversity in the workforce, any workforce. I think that people are working more at doing that right now. I think that's really important, and I think that also even when we recruit people, having people that have similar backgrounds, helping to recruit individuals, that helps us as well.
Well, happy Nurses Week Day kickoff, and I want to get to final thoughts. Do we have any reporters on the line before we do not? So, Rachel, I'm going to let you get us started on just some final thoughts, what you want us to know.
Oh, sure. I want to say Happy Nurses Week to all the nurses out there, our nurses and nurses serving all over. I think the last couple of years have just been so challenging in a million ways. And yet something has stayed the same, and that's that nurses have been strong and they've been focused and they've cared for each other and they've cared for their patients, and I am so very grateful for that. And I think it's just the perfect week to really celebrate nurses everywhere and the contributions that they make.
Tammy.
Sure, I would echo all of those thoughts. Those are perfect thoughts, and certainly happy Nurses Week to all nurses out there who are listening. And what I know is that nurses do what they do not because there's a Nurses Week or not because someone says you're doing a great job. It's they love what they do. It's one of the things that I so appreciate about our place. I think we talked about this the other day, Jess. You said, like, why do you think people do this? And I said, I think they love the work they do. I also think they love the team they work with, and that's really important. And we talked about the power of the team, the physicians and nurses and respiratory therapists and the entire team. I think they don't view themselves in a silo at all because they can't, because the way care is delivered is it's delivered together. And we know that people love being part of a great team, and I think we have a great team, and I think there are great teams throughout the healthcare in our country. So happy Nurses Week to all nurses.
Thank you both for being with us today. We appreciate you very much. Dr. Hawkinson.
Yeah. I think we need to start with the team, obviously. Dr. Stites and I have been a majority of a face and voice for the health system, but this is all a team, and more important is the day-to-day, the minute-to-minute care that is given here at the hospital. The vast majority of that is done by our nurses, and when we had, obviously, the COVID surges, the respiratory therapists, it's really all a team, all the way down to EVS, everybody who is helping here in the hospital. So I think that's the important thing to remember. In addition, I want to say, Happy Nurses Week to my sister, who's a great nurse up in Wisconsin as well. And, I also want to give a shout out. Tammy had said something earlier in the show, the very best care in the safest way possible. And I want to give a shout out to my infection prevention team and infection prevention nurses led by Amanda Cackler and Lance Williamson. Throughout the pandemic, even before that, they have continued to try and reduce the risk of you or your loved ones getting hospital complications and infections. They continue to do that today nonstop, and so I just want to give a shout out and appreciation to the infection prevention team.
Great, thank you for doing that. Appreciate that. All right, what do you got?
Well, I always talk about faith, hope, and science, especially on a Friday. Mm-hmm. You have to ask yourself, when you're sick and in trouble, you want to be heard. Who hears you? When our patients call with CF or transplant and they're in trouble, who hears them? Who brings the faith and hope and the science to the patient? You mentioned this earlier today about the impact of nursing. I think it's really true. And I think that point about faith, that intersection of faith, hope, and science, it was what can keep people strong in the hardest of time. I think the nursing staff brings that. And they bring that through listening and being there in the moment. And that's a powerful, powerful medicine. And I think it's one of the most powerful medicines in healthcare. And it's why we have such brilliant nurses here. 2 of them are at this desk, but it's why our staff is amazing. Being in the moment, listening, and responding personally and directly with the patient takes a special talent. It takes a special person. And I think we're blessed to have a lot of special folks here, Jess.
I agree. Stick with us because we've got a really great anniversary coming up here in just a moment we want to tell you about. But I want to just, we had a question come in from Betty, and I really liked it. And she said most nurses are women, but what are the benefits of having male nurses? I think that's what we think of, and I love it when I get to go up and interview our guys, and there's no difference, but what have we seen as far as the evolution of more men into the nursing profession?
Well, I think when we talk about diversity, we can talk about gender diversity as well. And I think we do have a number of male nurses. Of course we do in our place. And we continue to be very focused on all aspects of diversity, including gender diversity.
Absolutely. Thank you so much. Okay, so in our headlines this morning, it's a very special anniversary for one local boutique helping those through a cancer diagnosis. Missy's Boutique is a one-stop shopping experience for cancer patients, and it's celebrating its 10 years here in the Kansas City area. Joining us now to talk more about that is Judith Newell. She is the Appearance Center Manager over there at Missy's. Good morning to you. So good to see you.
Yes, good morning to you. So glad to be here this morning with everyone.
Well, 10 years, that is quite the milestone. Talk to us about how your store has expanded.
Okay, I'll be glad to do that. But first of all, Missy's Boutique would like to send out a big thank you to all of the nurses. We know their value. We hear it every day from our patients. Okay, all about Missy's. Actually, we've been here 13 years. 10 years is our launch with our partner, Bra Couture KC. And because of them, we have been able to help several thousand women who are underinsured and uninsured. So we thank them for that. Now about Missy's, right up here on the wall is some of the most fantastic comments our patients have made about us and what we do. We do honor our nurses here and our mothers for Mother's Day. Then moving back a little bit, this is the candy or the good feel part of our store here. All of the patients love to shop here. In fact, we had a patient yesterday. Well, actually, she came with a patient. The patient was doing chemo, and she said, by the time she's finished, I'm going to go broke. So there's a lot of good feeling going on in here.
Hey, Judy.
We are so proud. Yes. Yes. Hello?
Something you said that sticks out to me is that you said when people walk in, it's like you become friends with your shoppers. You're like best friends by the time they leave, right?
Oh, absolutely. And I always kid some of our customers and say, we need to have frequent flyer miles in here because when they're family or when they're going through treatment, they're in here all the time. Sometimes they don't even shop. They just come in and it makes them feel good. And so that's what we're so happy about.
Judy, I have to have you. Would you mind just introducing folks to the Missy's? I never like to talk to you without hearing more about them.
Yes, yes. I have my staff here. This is one of our mastectomy fitters, Karen. Karen has a fantastic background in marketing besides being a great fitter. And the days that she is here, our sales skyrocket. So the patients just gravitate to her and her outgoingness. And then let me tell you about the Missy's up here on the wall. These are the most important people in here. Missy Malter Newell on the left, Missy Wilcox O'Neill on the right. It's because of these two angels we have this beautiful boutique here. They asked that we do and create something that was one-stop shopping because when they was going through treatment, they had to go to a different place for everything. So now we have it all right here. Our patients come in, whatever they need, we can supply for them.
Judy, how do people access Missy's? How do they access Missy's? Do they need to make an appointment, or do they need to be a health system patient, or can anybody?
A lot of our patients come through our physicians or our nurses or word of mouth through classes that we are doing for communities to bring awareness. And so it's a lot of word of mouth. We just want to tell you that come through here.
No, go ahead.
No, I just said we see a lot of patients that come through here, and they always carry the word back to their doctors or whoever they run into about. They share their treatment and their story.
Well, we just personally want to thank you for the service you provide for women and men and,
Yes.
and the families, and giving them a place to come and buy gifts and a place to come and meet friends and to feel special and loved and confident during their cancer journey. And so we just thank you so much.
You're so welcome, and it is our privilege to do that for our patients. We're here for them. Thank you, Jessica.
Thanks, Judy. We'll see you soon. And before we go, there are a lot of people who want to say thank you to all nurses who have been on the front lines of the pandemic for the last 2 years. So as we leave you today, we want to share some of those messages. Everyone, thanks for being with us. Have a great weekend, and we'll see you on Monday.
Thanks to all the nurses for all their help and all the everything for the last 2 years especially.
I definitely want to say thanks to all of them. Obviously their work is needed. We appreciate it.
I mean, healthcare professionals, nurses specifically, just appreciate what they've done for the last 2 years. They've stepped up, taking care of people. In some cases they're in the hospital of their own shortcomings, so I just thank them for all they've done and appreciate it.
Hey, you're doing a great job. I mean, we went through the worst already, pandemic. Now we're just doing the little baby steps, so you got this.
Coming up Monday on the Morning Medical Update, about 30 million people in the United States have sleep apnea.
My partner has insomnia.
I'm Jessica Lovell. New research finds those sleepless nights could be tied to a disorder of the central nervous system. Join us Monday at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.